Welcome back. This is Your Health Television and Radio program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and we're happy to have you with us. As my next guest, I have another board-certified plastic surgeon, Dr. Matthew Romans from Salinas. Dr. Romans, thanks very much for being here.
Thank you, David, for having me.
Dr. Romans, I want to talk about your training and what it takes to become a board-certified plastic surgeon. And I know that you did some military duty, and I want to talk about that as well. I think that's a terrific thing to do. I think public service is great. I went to Annapolis, as many of our viewers know. So tell me something about your training and how did you become a board-certified plastic surgeon?
When I graduated medical school, I matched into a general surgery residency at Michigan State University and
excuse me, Dr. Romans, so where'd you go to medical school?
Loma Linda University.
So you went to Loma Linda.
Yes.
And then you matched into a general surgery program.
Correct.
So I just want to emphasize, so even before you went into plastic surgery, you did general surgery.
Yes. And I did the full general surgery residency, and I'm board certified in general surgery as well. And then I went and did a plastic surgery residency in North Carolina.
Well, Dr. Romans, how many years of training did you do in general surgery?
5.
So you did 5 years of general surgery training.
Correct.
And you're board certified in general surgery.
Yes.
And then you went on to a plastic surgery residency.
Yes.
Okay. So I think it's important to point out that you just didn't take a weekend course in facelifting or something.
Absolutely.
You did the total general surgery training, got board certified, and you did the total 2 years or 3 years?
2 years.
So another 2 years of plastic surgery training.
Correct.
Now, what about your resume? I know you were in the Army or the Army Reserves.
Yes, when I was in general surgery residency, I joined the reserves, and it was just before the first Gulf War, probably 4 months. But during my residency, I wasn't a fully trained surgeon, so they didn't call me up because they would have had to use me as a general medical officer. So they let me complete my general surgery residency training in peace. And by the time I completed my surgery residency, I had both plastic surgery and general surgery. We weren't in any police actions or wars around the country or the world, and so I was able to resign, and after 12 years, probably the year before we went to Iraq. So I probably avoided having to serve there. So.
Well, Dr. Romans, you know, I need to recognize, I think public service is a great thing to do, and congratulations on that. You know, the Monterey Peninsula and our county, between Fort Hunter Liggett, and we used to have Fort Ord and the Naval Postgrad School and the DLI and the Presidio. We've got a very close connection to different branches of the military. And I think it's an honor for us to take care of our troops and our sailors and soldiers. So congratulations. I think that's a great thing to do, public service. So, Dr. Romans, you have an office. You are practicing in Salinas.
Salinas, that's correct.
Right. Okay, so what I want to talk about, you know, as you know, my audience knows I love to talk about plastic surgery, of course. So let's talk today about body contouring.
Okay.
You know, you can barely pick up a paper or a magazine and there's an ad about liposuction. People know about tummy tucks, abdominoplasties, thigh lifts. So can we start out by talking about liposuction? I want to try to clear up myths today about body contouring with you.
Okay.
My first question is liposuction a weight loss procedure?
No, it is not a weight loss procedure. I tell my patients that you can only safely suction off 5 to 10 pounds at most. If you go over that, then it becomes a dangerous procedure in most circumstances. It's really a contouring procedure to get off those pockets of fat that you're unable to remove with diet and exercise.
Okay, so I think that's really key. Now, but you did mention that it's possible to suction away 5 to 10 pounds. I mean, for a lot of people, that sounds like a lot, and it can be a lot. But you said that liposuction is a way to contour certain areas. Is that right?
Yes.
Now talk about what areas you mean. Where do you commonly perform liposuction? What parts of the body?
Well, probably the most common areas are on the stomach or the abdomen. Anywhere around the mid portion of the torso is very common. The hips or the love handle area, spare tire area is what men refer to it as. And then, of course, the back works fairly well for the rolls on the back. Other areas, probably most next common, are the thighs, both the lateral thighs and the front of the thighs and the inner thighs. The other areas that you occasionally can do are the knees, ankles, there's a much less common. And on the face, I think under the chin and the submental area, and this area here is a very good area to liposuction.
Right. Dr. Romans, I find in my practice there's a difference between the areas that men want liposuctioned and women want liposuctioned. I think the most common areas for men, I think, is in the neck area or under the chin, and also what the guys call the love handles.
Right.
Now for women, I think it's the outer hips, and I think it's the tummy.
Absolutely.
Now, sometimes a woman will want her neck and under the chin suctioned, but I think for men, it's mostly the neck and love handles. For women, it's the tummy or the abdomen and the sides of the hips.
I agree. That's pretty close to the distribution for my patients as well.
So, Dr. Romans, people, I think, really want to know what liposuction is and what it's about. Can you talk about technically what you do to introduce the cannula, right, or the tube? So, how's that work?
Well, basically, liposuction itself is mechanical removal of fat, and there are various techniques of doing that. The most important thing is that you start out by infiltrating the tissues with fluid containing usually local anesthetic agents and, most importantly, epinephrine or adrenaline, which helps vasoconstrict the blood vessels and prevent a lot of blood from coming out with the fat when you suction it out.
Oh, okay, so it's an actual tube, right?
Correct.
That we insert. We call it a cannula.
Correct.
So we make a very small incision. Now, Dr. Romans, you have a ambulatory surgery facility connected with your office.
Yes.
Right? Now, do you do liposuction under local, under general? Do you do it at the hospital? How's that work?
I do it under general anesthetic. I used to do some liposuction under local, but it's difficult to get the patient completely comfortable during the procedure, and I just think it's more easy for the patient to be asleep for the operation. As far as whether I do it in my office or in a hospital, it depends on how much I'm trying to get out of the patient, how much fat I'm trying to suction out of the patient. As you know, in California, there's a law that if you suction over a certain amount, I think it's 5 liters of total fluid and fat out, then there's required to be hospitalized or monitored overnight by law. And I think that's legislating good sense, basically.
Right. Dr. Romans, one of the things I want to mention, we talked about anesthesia. At one time, I guess doing it under local was more common. I've been in practice almost 20 years, and the difference and the safety in anesthesia has been terrific.
Yes.
We have highly trained, mostly board-certified anesthesiologists with us. So I think it's much safer now for a patient to get a heavy sedative or a general anesthetic than it was even 20 years ago.
Absolutely.
So another thing that patients ask me, does liposuction really work? I mean, when you put in that tube, can you actually vacuum out fat?
Yes, you can. I think the critical thing for liposuction to work is the quality of the skin. People who have a lot of loose, flabby skin, if you suction that area, you'll make the loose, flabby skin typically worse, but make it very uneven in contour. I think people have to have very good toned, elastic skin over the areas that you're liposuctioning, or your results will probably not be ideal.
Well, Dr. Romans, see, that's key there, what you just said about the quality of the skin. A very rough rule of thumb that I try to go by with my patients, I tell them that people under 30, we can be a little bit more aggressive vacuuming out the fat. People over 50, we have to be pretty conservative because of that loose skin problem. And people between 30 and 50, it's just a case-by-case basis.
Absolutely.
So again, let's talk about, can we talk about the ideal patient for liposuction? Like who do you recommend liposuction to?
I think the ideal patient is a younger patient. If they're older, it's like you said, they have to have good skin elasticity. They shouldn't have a lot of loose skin over the area. They should be in general good health, because it is better to operate on healthy people. This is elective surgery, and safety has to come first. And unhealthy people should not undergo operations like this without being very careful.
Right. Now, Dr. Romans, I think you do a fair amount of body contouring in your practice.
Fair amount.
Yeah. Is liposuction something that you enjoy doing?
I enjoy it. It's a lot of work. I mean, I think people underestimate the amount of time it takes to do liposuction well. As I've gone on in my practice, I've moved to smaller and smaller cannulas, which tend to be less traumatic to the tissues, but take longer to get the fat out. And I think I also use ultrasonic liposuction in conjunction with standard liposuction because I think it does help break up the fat better, especially in real fibrous areas. So that adds extra steps to the procedure. So it takes a long time to do liposuction correctly.
Now, those are really key points, and I want our audience to understand this. When you said you use smaller caliber cannulas, you mean they're thinner tubes?
Yes.
So it's probably easier on the tissue in some sense,
Yes.
but it takes longer to get the fat out. It's
Right.
a thinner tube. Now, tell us more about ultrasonic liposuction. What's that all about?
Well, standard liposuction is hollow tubes with holes in the side hooked to a vacuum, and as the cannulas pass back and forth, the suction pulls the fat in, and the sharpness of the edge of the holes helps tear it loose and bring it out. Ultrasonic liposuction the first generation ultrasonic liposuction machines and combined high speed vibrating cannulas with the suction. And the problem with the first generation ultrasonic liposuction, there's a lot of burns and tissue damage because it was fairly high energy and the tips could perforate organs or they burn the skin or something like that. I use a third generation ultrasonic liposuction called Vaser, which has the tube separate from the suction component. And you pass the Vaser cannula first, and it's a lot lower energy, but the way the cannulas are designed, it helps break up the fat with less thermal injury to the tissues, and then I finish that up with standard liposuction to suction out the fat.
Well, no, so that's important to emphasize. So there are certain areas, I think you said, for where the areas where the fat is kind of fibrous or tough to get out, where you prefer to do ultrasonic treatment first, and then you vacuum out the fat with a standard cannula.
Yes.
Dr. Romans, you mentioned the quality of the skin as being all important or ultra important. So when would you, there's two more things that we need to talk about. First of all, when do you recommend that someone has skin excised, like for example in a tummy tuck or an abdominoplasty? And also, before the end of this segment, if we can talk about when you need to tighten muscles, that would be helpful.
Okay.
So let's talk about the skin. At what point do you say, you know, you need not only liposuction, you need to have some skin excised? Now, at what point do you advise that to a patient?
Well, the most common area where this comes up is the abdomen. And having children is very hard on women's stomachs and abdomens, and they stretch and contract and stretch and contract. And after a while, it just stops contracting after pregnancy. Sometimes with some women, it's after the first pregnancy. And they end up with a lot of excess skin on their abdomen. If you just do liposuction on that, it's not going to shrink down. So most of those women need to have an abdominoplasty or a tummy tuck, which is excising the skin and the fat, and it may or may not be combined with some liposuction.
Okay, so at a certain point where the skin loses its elasticity, if they want to improve their abdominal contour, the skin is removed.
Correct.
And of course, the downside, I tell all my patients they get a scar.
Right.
Right? But whereas with liposuction, the incisions and the scars are very small.
Yes.
Sometimes you can't find them.
Right.
Now, Dr. Romans, you mentioned pregnancy. What about tightening up the abdominal wall musculature, or more importantly, the fascia over the muscles? Maybe we can start by defining that word fascia.
Well, fascia is the whitish colored connective tissue that lines all or encases all of the muscles in our body. And on the abdomen, that's a very thick, fibrous sheet of tissue that overlies all of the rectus muscles, which are the washboard abdomen muscles, and then the obliques and transversalis muscles that come in from the side. And pregnancy stretches out the fascia. And sometimes it stretches it so much that the muscles, the two rectus muscles, which are supposed to be side by side, don't even come back together after pregnancy because they get stretched apart. So one major component of a lot of tummy tucks in most women is a row of sutures in that muscle tissue to tighten it back together in the middle.
Okay, so that's what we call muscle tightening or fascia tightening,
Right.
along with a tummy tuck or abdominoplasty.
Correct.
And do you ever combine a procedure? Will you ever do liposuction and a tummy tuck at the same time, or are they done totally separate?
I will. They have to be a good candidate for it. I typically am very cautious about liposuctioning on the abdomen itself and anything that I'm undermining at the same time as a tummy tuck, because it's kind of a double whammy on the skin and you can cause some healing complications. But I will, at times, liposuction other parts of the body at the same time as a tummy tuck. But bear in mind that a tummy tuck takes between 2 and 3 hours, and the liposuction can take several hours depending on how much you do at one time. And so it becomes a very quickly can become a very large operation.
Well, Dr. Romans, you're starting to raise a very important point, and that's safety.
Yes.
You know, people ask me all the time if liposuction is safe. How do you talk to your patients about the safety issues around liposuction?
I think it all depends on, first of all, the overall health of the patient, and if providing their good health, or reasonably good health, and then the volume you're trying to target and get out at once. I think small areas of liposuction are very safe. As you go up more and more and get closer to the high volume range, which is anything over 5 liters, then you become into a whole new realm of safety. And I think anytime you look at places around the country where people have unexpectedly died from cosmetic surgery, there's almost always a large liposuction involved.
And which raises the issue that we need to let people know that liposuction is not like going to the hairdressers and getting a new hairstyle. It's a real procedure.
It's a real operation.
Right. And an abdominoplasty or tummy tuck is probably one scale above liposuction. Isn't that true?
Yes.
So how do you evaluate preoperatively? We've only got about a minute left,
Okay.
but how do we evaluate preoperatively? Let's say a woman has had 2 or 3 children. How do you evaluate if she needs her muscles and abdominal wall tightened up or not?
Generally, you can have them lie supine or flat on their back on a table, and I usually have them raise their head off the bed, and that helps tighten the muscles so I can palpate them through the skin, and I can kind of get a general feeling as to whether or not they're real lax or separated. Generally, most people end up needing some tightening. It becomes just a degree of how much, and unless they've young, healthy women who've never had children typically don't require tightening.
Dr. Romans, I appreciate that. So I think in summary, we can tell our patients that liposuction really does remove fat cells.
Yes.
And the incisions are very small,
Correct.
and hence the scars are very small. But if they need skin excised, say for a tummy tuck, now that's a real scar.
Yes.
But we can also tighten up muscles if need be inside. Isn't that true?
Yes.
So, Dr. Romans, we only have about 30 more seconds, but
Okay.
could you give us your website and or phone number? I know you are in Salinas, so that's Matthew Romans,
Yes.
R-O-M-A-N-S, and your website is?
www.salinasplasticsurgery.com.
And do you have a phone number you could give out?
It's 758-2746.
Dr. Matthew Romans, board-certified plastic surgeon, thanks very much for being here.
Thank you.
I'm Dr. David Morwood. I am a board-certified plastic surgeon here in Monterey, California, and this is Your Health television and radio program. Thanks very much for being us. Please come and visit us again soon. Thank you. Dr. Romans.